Доброе утро. Можно активировать экран, чтобы я могла скачать флеш memory? Спасибо. Но что-то он опять заблокировался. Взять лекцию с экран, что-то не активирован.
Экран не активирован.
Какие-то квадратики рисуются. Все.
Это вот это, да? Вот?
Да. Лучше скачать свой спокойно. Сегодня египтяне.
Раисовна, эта девочка Алия,
Dear students, keep please seat after seat. Every other seat, not every seat. So that you keep social distance. Thank you very much. Хорошее замечание. Спасибо. Резину будем? Меня в смысле. Вообще нет. Yes, please.
Okay, good morning, guys. We're glad to see you in our lecture. And we start, and I hope this lecture will bring for you new knowledge, new things, and you will using all things. Welcome. Спасибо большое.
Спасибо вам большое. Thank you very much, Zelia Raisovna, for your kind introduction. Good morning, everybody. Welcome to our last lecture in the series of lectures about the pharmacotherapy aspects of COVID-19. And I'm glad to see those students who attended already from the beginning, and welcome the new students. For those who don't know me, I'm Professor Naila Bulatova from the University of Jordan School of Pharmacy, the Department of Clinical Pharmacy and Biopharmaceutics. And at the same time, I'm an adjunct professor at the Department of Pharmacology and Clinical Pharmacology here at the Bashkir State Medical University, teaching the second year dentistry students and the third year medicine students, the subject of pharmacology in English. Maybe majority of this audience, I understood that you did not reach the pharmacology classes, but when you reach, you will have the chance to have the lectures with me, hopefully. All right, today is maybe the most easy part of our lecture, lecture number 6. I will talk about the traditional, integrative, complementary, and alternative medicines for the treatment of COVID-19. Извините, пожалуйста, а можно сделать так, чтобы да, слайды были для меня тоже видны передо мной? Спасибо большое. Okay, we all know that all over the world, people are using the complementary, traditional, integrative, and alternative medicines widely. And because until now, we do not have the satisfactory treatment of the COVID-19, and because the vaccines have appeared relatively recently, they have appeared maybe December 2020, so we are talking about maybe several months, 8 months or so. So before that, people started trying using the traditional, complementary, and alternative medicines. But unfortunately, until now, there is no solid evidence that supports the safety and effectiveness of these treatments. As we are going to see, I will try to provide you the evidence through this lecture. Where are we standing currently with these treatments? And what are these treatments? I will explain right now. As you know, probably those who are senior students or those who are junior students don't know yet, when we are talking about the treatment or when we are investigating the treatments, we always care about two things mainly. What is the effectiveness, or simply saying treatment working or not, right? We care, is it effective or not? And the second thing that we care about always, whether the treatment is safe or not, whether it is producing the serious adverse effects, or the patient cannot tolerate the treatment because he feels bad, maybe he has gastrointestinal upset, or he has headache or something. So always when we are doing the investigation about the drugs or new treatments, we explore both effectiveness and the safety or adverse effects of such therapies. Now, I need to give the definition of the traditional medicine, or I use the term traditional, integrative, alternative, and complementary medicine. And according to the World Health Organization that you know very well, WHO is the abbreviation for this organization. Traditional medicine is the sum of total knowledge, skills, and practices based on the theories, beliefs, and experiences indigenous to different cultures. Simply saying what you know from your mothers, fathers, from your grandfathers, and so on. What is traditionally used in your country, and it is believed that this treatment is effective, right? So it depends on the culture, what traditional medicine is used. whether it is explicable or not, whether it is confirmed in the clinical studies or not. And this treatment is used in the maintenance of health as well as in the prevention, diagnosis, improvement, or treatment of physical and mental illness. We may use, for example, something to protect ourselves from COVID-19, not to get ill, or to maintain simply the immunity very well in general so that we do not get sick with other viruses or bacteria. Or some these approaches are used for the diagnosis. I don't have the examples, maybe you can help me. What can be used traditional medicine in the diagnosis? Maybe the smell of the body or something, you know, that all doctors and old people, they know how to diagnose without any medicine, how to diagnose certain diseases. For example, diabetes. Improvement of treatment of physical and mental illness. Okay, so this is traditional medicine, okay, but I'm using combined term, traditional, integrative, alternative, and complementary medicine. All together, it is better to use. What is complementary or alternative medicine? This is a broad set of healthcare practices that are not part of that country's own traditional or conventional medicine. For example, okay, in Russia, we are using the medications and surgery and radiotherapy. This is traditional medicine that we study at the School of Medicine or dentistry. But also at the same time, we know that in certain village, they use honey mixed with certain herbs to treat the common cold. This is complementary alternative medicine. This is not the mainstream that we study, but we know that it may be effective. So this is very close to the traditional medicine. And this is according to the WHO definition. So it is not fully integrated into the dominant healthcare system. For example, I was in Malta on my trip and I came with very severe chest infection. And I could not cure myself, maybe for 1 month. I was coughing and feeling very bad. Then my mother-in-law came and she said, take hot milk and add to it a piece of butter and a spoonful of honey. And I felt much better. So this is the example of such complementary or alternative medicine. And they are used interchangeably with traditional medicine in some countries. And you can visit the WHO site to see more information about these treatments. So I will be using the abbreviation TCAM. TCAM stands, I repeat, for traditional, integrative, complementary, and alternative medicine. So mostly it includes the natural products and mind and body practices such as herbs, as I said, certain minerals. In India, for example, yoga, in China, Tai Chi, and Qigong, and many other practices. Hijama in Arabic countries, if we are talking about Jordan, for example. Such practices are examples. In addition to that, we refer here the dietary supplements. For example, you know, in the pharmacies, we have certain amino acids, we have certain other natural products like zinc supplement, omega-3 omega-3 fatty acids, and other products. These are dietary supplements. We have herbs, for example, valerian or other roots or other plants, chamomile are used as tea. Also, we refer here vitamins and minerals. Vitamins, we can use multivitamins or we can use a particular vitamin. For example, in relation to COVID-19, I will be talking today about the vitamin C and vitamin D as well. And certain minerals in relation to COVID-19, as you know, zinc is very much popular and believed to be beneficial. Probiotics are those preparations that are obtained from the dry cultures of useful bacteria that are found in our GI tract, for example, lactobacillus and other bacteria. And they are present in dairy products like Activia that we drink, or in Russia, there is Bifidoc, also rich in this bacteria, but also there are certain tablets or suspensions sold in the pharmacies that contain these cultures of bacteria. So we call them probiotics. Why they are probiotics? Because when they are consumed by ourselves, they create normal flora, they restore normal flora, you know, we have antagonism between pathogenic bacteria or bad bacteria and the normal bacteria. So we consume these products, we restore normal flora, and it is believed to affect our immunity and to improve our health. So among these approaches, the most popular used by adults, at least in the Western countries, are yoga that came from India. Chiropractic are certain manipulations on the joints, mainly on the spinal cord. It is harder than massage. We do sometimes manipulation, we can hear even sounds when we restore the positions of the joints, and particularly the spinal cord. And osteopathic is very close to this. Acupuncture, as you know, also acupuncture came from China, and it is insertion of needles, either silver needles or golden needles, according to the certain active points in the body. Meditation, it is related to yoga, but not only to yoga. Other relaxation techniques, such as breathing exercises, there are special type of such exercises. They improve the mind state very much, and it is shown in the trials. Guided imagery, you imagine things according to certain guidance. Progressive muscle relaxation. Tai Chi and Qigong, as I told you, these are certain exercises and breathing practices that came from China. Hypnotherapy, and this is according to the National Institute of Health. Some of TCAM preparations lack available data regarding efficacy. This means that we need to have more and more studies. We don't know exactly. Okay, we know historically they help to some people, but we would never believe that scientifically until we perform clinical studies on this. I explained that in my previous lectures. Until you perform the very well-designed clinical study. Again, aspects such as efficacy, adverse effects, which is safety, manufacturing method. We need to know whether to do this product for the oral use or for the injections or for the topical use. We need to study all this, and quality control, how pure this preparation is. Does it contain any toxic ingredients in it or not? So we need to analyze this product for its content. So fortunately, we have the approved vaccines now, and also we apply in every country the public prevention measures such as social distancing, hand hygiene, as you know, contact tracing. If somebody is sick, we see who of the other people were in close contact so that we can isolate these people as well. Lockdown policies, when there is large outbreak, you know, countries, they apply very strict measures, prohibiting collection of people, etc. So this remain the mainstay, and okay, still there is a large interest in the prevention and treatment of COVID-19. So as you know, even if you talk about the traditional medicine, and as I explained in my previous lectures, even the well-established drugs such as hydroxychloroquine. What is hydroxychloroquine? Antimalarial, right? In the beginning of the pandemic, hydroxychloroquine was proposed to be effective, but later studies showed no benefit. And similarly about remdesivir, okay, remdesivir is approved in countries including Russia, but still we have 50-50 maybe, or a little bit more evidence that it is effective. And that's why we use it only in hospitalized patients, not in every patient with COVID-19. So limited effectiveness, and maybe the only treatment proven to be effective in clinical trial is the dexamethasone, which is the corticosteroid, as we know also from the previous lectures. That's why the public is concerned about the prevention and treatment of COVID-19, and they are exploring the treatments on themselves. Sometimes they see in the social media, okay, this nutrient is effective, this herb is effective, let us take this supplement and this supplement. Let us see what is the current evidence. For example, in the low and middle income countries, probably most of you come from such countries, they rely in 70% of cases entirely on the complementary and alternative medicine. Because of the cost, they don't go to the doctor, they don't go to the pharmacy, they just obtain what is available in the herbal stores or in the, in the general stores, and they use those approaches to their health improvement. So we need them more and more information about these treatments. Okay. Let us see what are the current practices in different countries. I will briefly talk about China, probably because the China uses largest number of the complementary and alternative medicine, and they have many Chinese preparations. This is called traditional Chinese medicine, or TCM, and it is recommended officially by their China National Health Commission, or NHC guidelines. So this is governmental approval, and they are promoting the use of such medicines, and it is reported that around 85% of patients uses it with standard treatment. And probably that's why, I don't know, they are very well in controlling the disease currently. There are very few cases in China, although this was the beginning of outbreak, but now they are able to control the disease quite well. The TCM, traditional Chinese medicine, was used to treat COVID-19 patients in Italy as well, where there are many, in Italy, there are many Chinese doctors, and they helped also to control the outbreak in Italy. And historically, they already have the experience with the TCM in other infectious diseases, for example, in influenza, in other respiratory tract infections. And they use this treatment based on the symptoms, controlling the symptoms. For example, they have cough, the people have cough, they are receiving medicine against cough. People who are having fever, they address this symptom along with the traditional indications. Doesn't mean that the TCM is used alone, but they add it to the official medicine and they get good results. I will not pronounce the names. You can see the names of 15 TCM that are recommended as oral formulations. Okay, it's very difficult to pronounce their names. Anyway, we are not familiar with them. Or just to say what they are doing in different countries. And they have also 8 injectable formulations with different names. Okay. And the China Food and Drug Administration, CFDA, have approved one of them, Xubijin, I hope that I pronounce it well, with the treatment indication of new coronavirus pneumonia with severe and critical systemic inflammatory response syndrome and multiple organ failure. And the other preparation, Lianhua Qinwen, with a new indication of treating for fever, cough, and fatigue caused by the light and ordinary types of the new coronavirus pneumonia. So 2 preparations of traditional Chinese medicine are officially approved. They are using them along with the official medicine. Each of their formulations, usually it is a mixture of active ingredients to have multi-target effect. At the same time, they target, for example, cough, fever, fatigue, whatever symptoms are controlled, making it challenging to develop drug resistance. Usually when we use one drug, there is a chance that the virus or bacteria will create certain mechanisms to become resistant to this treatment. But when you have several drugs in one component, then with different approaches, with different mechanisms of action, we are hoping to reduce the resistance chance. Also, many of these TCM formulations are powerful anti-inflammatory and immunomodulatory, meaning that they not only kill the virus, but also they suppress the systemic inflammation, which, as we know already from the previous lectures, the systemic inflammation may lead to dangerous cytokine storm and acute respiratory distress syndrome and progression to mechanical ventilation and death. So also they are conducting currently different trials in China assessing the effectiveness of these and other products in the COVID-19 treatment. Now, many of you come from India, and I have some data from India. They have a Ministry of Ayush, which stands for the Ayurveda, Yoga, Naturopathy, Unani, Siddha, and Homeopathy. So this is the official body in India, and they looked at the infectivity, how infective and severe is the COVID-19 infection. The government of India suggested measures that includes the use of homeopathic medicine. You know what is homeopathy? Indian people maybe know, but I have to explain to the other students. Homeopathy is using the principle similar is cured by similar. And this is very surprising maybe for those who don't know about homeopathy. You take the drug that causes fever to treat fever. You take the drug that causes cough to treat cough. Similar, cure similar. But what is the difference? That this homeopathic medicine is used in very minute amount, maybe several molecules, just several molecules of medicine in a solution that contains large amount of water. How does it work? It is remarkable. Some scientists, they agree with this treatment. Other scientists, they do not agree, but in many cases, there is a benefit from the homeopathic medicine. So they suggested, I mean, the government of India, that some homeopathic medicines such as arsenic album 30C and Ayurveda preparations such as Katha. Katha, they believe that this is the most powerful in India. Katha contains ginger, all right, curcumin, cloves, honey, fennel seeds, cumin seeds, and lukewarm water as an immunity booster. So it is officially approved in India. And as reported from Pune, India, in mid-2020, COVID positive patients who were treated with combination of hydroxychloroquine that was alone shown not to be effective, but when they were using hydroxychloroquine and homeopathic medicine of this type, they reported reduction in recovery time. So time to get healthy was reduced with this combination. But the name of that homeopathic medicine was not disclosed in that trial. In another part of India, in Gujarat, Ayurvedic preparation and homeopathic medicine were administered to more than 3,000 people, and among them, 2,000 were in quarantine to boost the immunity as a preventive measure to COVID-19. And none of the persons who received this mixture, as per the guideline, developed signs and symptoms. Okay, they were isolated because they were in contact, but they did not develop the symptoms, or they were isolated, sorry, because they were positive for the virus, but they did not become symptomatic. They remained asymptomatic because they received this medication. And Gujarat government has issued a guidance regarding the use of Ayurvedic and homeopathic medicine as an immune booster to prevent this virus infection. Unfortunately, these data are coming from 2020, I have to say, when the situation in India was much better than with the new variant. Now the Delta virus, as you know, is predominant, and we do not have the data yet with this situation. But previously, some treatment approaches were successful. Also, the Ministry of Ayush guidelines advocate the use of yoga and herbal products such as Umbilical officinalis, or it is called Indian gooseberry, Ocimum teneiflorum, which is basil, and some branded herbal formulations as immune boosters, and other herbs of relevance in South Asia, I mean, not only India, but also, for example, Japan, Vietnam, Philippines, etc., include curcumin, and curcumin is in wide use probably in your countries. Quinine is antimalarial, and it is obtained from the plant, cinchona bark. And echinacea is used also as commercial tablets. It is produced as echinacea tablets for the antimicrobial, antiviral, anti-inflammatory, and immunobooster activities, respectively. Limited evidence has been published in relation to their effectiveness. Okay, they are used. Don't confuse. They are used by the people, but what is the evidence should be shown in the clinical trials. And we have several clinical trials results that I am going to discuss with you further. So limited evidence now has been published in relation to their effectiveness. In vitro studies do not say anything to us because they are conducted in the laboratory vial or in the Petri dish. But this shows that this is promising treatment and should be further investigated in animals and then in humans. And only after the clinical trials in humans, we will say this is effective and safe. So currently in vitro, the Indian study has shown that Letняя somnifera, which is ashwagandha, I hope that I pronounce it correct. Antinospora cordifolia, which is giloi or giloi, and Ocimum sanctum, which is tulsi, are linked to the protease inhibition activities of SARS-CoV-2 virus. And we discussed that the inhibition of the protease activity of the virus is one of the promising approach, even for the synthetic drugs. So if this is shown for the plants in vitro, we need to go for the further investigations, as I said. And also the WHO has acknowledged the effectiveness of Artemisia annua, which is a medicinal plant available in India, Pakistan, and some other countries as a potential pharmacotherapy candidate. It is still a candidate, not the approved treatment for the COVID-19. So until now, what is the situation in India? That conclusive evidence of role of yoga and Ayurveda are lacking. And as I said, we have potential role of several treatments that should be investigated in the clinical trials. We need to conduct them very well to see the efficacy and safety of these interventions. Middle East, I believe we have today people from the Middle East, right? Maybe from Egypt and other Arab countries, right? Also they are progressing well in the investigations of complementary and alternative medicine. Actually, traditionally, countries with Islamic history are rich in the use of many herbal treatments. They are also mentioned in Quran, in the Holy Quran, and this is known as Arabic or Islamic medicine. For example, one study from Saudi Arabia showed that over 1 in 5, which is roughly 22% of survey responders, they conducted the survey similar to the survey that I have conducted also among you, if you participated in this survey. So the number of participants was over 5,000. Okay, so about 1 in 5 responders were using herbal products during the pandemic because they believe in the effectiveness of these medicines in the prevention of COVID-19. Meditation or treatment of Holy Quran, reading the Holy Quran, cupping therapy, which is known as hijama. I don't know whether you have it in Egypt or not. Yes, in Jordan, it is very popular. Acupuncture is Chinese actually, but it is adopted in many, many countries. Also garlic, massage, specific nutritional tonics prepared by people, herbs, including what? Honey is actually not herb, it is the bee product. But dates, figs, peaches, garlic, I mentioned, olives, chamomile, which is in Latin Anthemis hyalina, and black cumin seeds, which is Habbat al-Baraka bil-Arabi, right? So they are all believed to be helpful in relieving symptoms of COVID-19, such as fatigue, loss of smell, and breathing difficulties linked to this disease. Particularly Nigella sativa, the black cumin or Habbat al-Baraka, when it was combined with grinded Anthemis hyalin and honey, this is called Tibuvir, was referred to prevention and treatment of COVID-19 potential. Other herbal products described in the literature, as I mentioned, include garlic, onions, and ginger. And Egypt is already very well known to conduct several trials. Shabab? Okay. A clinical trial in Egypt, for example, one of these trials aimed to evaluate the therapeutic potential of licorice, which is in Arabic sus, okay, licorice, or it was mixed actually with Boswellia serrata gum, and it was reported that they produced anti-inflammatory, which is important during COVID-19, antiviral, antithrombotic is also important during COVID-19 because many people die from thrombosis, not from the virus itself, but from thrombotic complications, as we know from the previous lectures, and immunomodulatory properties. So this clinical trial that refers to these two medicines that I mentioned is still ongoing, and hopefully we will have some promising results very soon. Another clinical trial is conducted in Iran. Do we have people from Iran here? Okay, very good. To assess the effectiveness of colchicine, probably when I was overviewing the medicines, I was saying that colchicine from long time, it is used as it is a synthetic drug, and it is used, for example, in the treatment of Mediterranean fever and some other inflammatory diseases. Colchicine was very promising in COVID-19, but then it was shown not to be effective. But Iranian study is investigating its combination with the herbal phenoic monoterpene fractions. And maybe this combination will allow to use lower doses of each drug and will be additive or effective. So when you look into the literature, you will find more than 300 mentioning. If you go to the scientific literature, search in the PubMed or whatever, more than 300 mentioning, and 60 of them are unique. The majority mentioned the traditional Chinese medicine. As I told you, China, probably they conducted the most of these investigations. Then on the second place after the TCM comes vitamin D. Also many investigations are now done. Next is melatonin. Melatonin, probably you know that melatonin is the hormone produced by our pineal gland in the middle of the brain. But melatonin is very well known to control the circadian rhythm. What is circadian rhythm? The day-night shifts in our body and regulates the sleep in particular. But interestingly, melatonin receptors are also present on the immune cells, which means that with melatonin, we can regulate our immunity, and hopefully we can regulate the defense mechanisms. But please always stick to the social distance. Keep one seat between you. Keep one seat between you. We have a couple of seats here. We have 2 seats here, yes, on the front row, and 1 seat on the second row, please. All right. So we were talking about the melatonin has promising immunomodulating activity, phytochemicals, general herbal medicines, vitamin C, as I mentioned, is of much interest. Ayurveda, natural products in general, not specified what are they, probiotics, even cannabidiol or cannabis, which is marijuana in American way. Not the marijuana itself that produces the dependence, but other fractions in cannabis. Chiropractic, general TCAM, not specified, acupuncture, homeopathy, marine natural products which come from the sea, antioxidants, flavonoids, which are fractions from the plants, tea, different others. The others, they are just mentioned once. So I will not go through this exhaustive list of the different studies that were mentioning the TCAM approaches. And also a number of studies that reported the combined approach when not a single treatment was used but several treatments were used, include the moxibustion. This is a kind of reflexotherapy similar to acupuncture. Ascorbic acid, which is vitamin C, as we know, zinc, and acetylcysteine with vitamin D, curcumin, glyceric acid. Glyceric acid comes from the licorice plant, or Sus bil-Arabi. Okay, essential oils, their combination with phytochemicals, exercises. Exercises, surprisingly, they improve immunity and they improve also the mind state. You know, during quarantine or lockdown, also many people, they get anxiety and depression, or also without the lockdown, many people, they experience anxiety state and depression state because of uncertainty in the future. Okay, so exercises are good, guided relaxation, melatonin, natural products, plant bioactives, in combination with probiotics, etc., etc., etc. So what I'm trying to say that there is a lot of investigations that are ongoing. So This is the summary. What are the most investigated? This means that these are the most promising approaches, hopefully. As you can see, the largest number of investigations are in the TCM, traditional Chinese medicine, as I mentioned, followed by the vitamin D, then melatonin, then vitamin C, we can mention here, Ayurveda, acupuncture, probiotics, and the others, of course, others are combined. They comprise large number of research, but they are different approaches. Okay, I just want to tell you how many clinical trials are ongoing in COVID-19. Пожалуйста, мы могли бы по ссылке перейти в интернет. Будьте добры. I would like to refer you to the official site, which gathers all the information about all clinical trials that are taking place in the world. So anyone, if you decided, hopefully in the future, you will become the investigator and you will be conducting clinical trial, you have to register with this authority that you are conducting such and such trial and you are planning to do so and so. So this is the site. It is from the US National Library of Medicine and National Institute of Health. And you can appreciate here that it shows the more than 6,000 studies conducted in COVID-19. Okay. Спасибо большое. Можем вернуться к слайду. Different. You can see the status of the trial. Still recruiting means that still taking more and more patients, completed or closed. So according to the currently performed trials and those trials that have been already finished, what are the recommendations? For example, you as a medical or the dentistry student, you might be asked by the people, general people, maybe your relatives or some people in Russia, do you recommend such and such treatment? So this is the WHO recommendations at the current stage regarding each treatment. Vitamin and mineral supplements, they cannot cure COVID-19 until now. Doesn't mean, I repeat, that this is a bad treatment. Please understand me correctly. This is the current state of knowledge that will be dynamically changing according to more and more information that we will receive from the currently conducted clinical trials. But currently, micronutrients, including vitamin D, vitamin C, and zinc, okay, we know that they are critical for a well-being of the immune system and play a vital role in promoting health in general. But currently, no guidance on the use of such micronutrients as treatment for COVID-19 exists. And of course, the WHO are coordinating. Only one student here and one student can sit on the second row because we need to keep the distance, please. So WHO, of course, is coordinating the many studies to develop and evaluate the medicines to treat COVID-19. Next, belief. In the WHO, they just answer them facts. They provide the facts in answer to different myths and beliefs, sometimes misleading beliefs that exist among the general public. Adding pepper to your soup or other meals does not prevent or cure COVID-19. Okay, it is tasty, but the best way to protect yourself, the WHO says that to keep at least 1 meter away from the others, washing hands frequently and thoroughly, and maintaining the balanced diet, stay well hydrated, exercising regularly, and sleeping well. Next belief, eating garlic can prevent the infection with the new coronavirus. Garlic, as you know, is antiviral in vitro against many respiratory viruses, and not only respiratory viruses, but the current state of knowledge is saying that there is no evidence from the current outbreak that eating garlic has protected people from the new coronavirus. Next, this is actually not the herbal medicine, but some people believe that regularly rinsing the nose with saline, or normal saline, which is 0.9% of sodium chloride in water, help prevent infection with the new coronavirus. By the way, there are promising clinical trials. If you go to the clinicaltrials.gov, you will see how many investigations are still researching this area, because mechanical washing of the mucosa might be preventive, might be. But until now, there is no evidence that regularly rinsing the nose with saline has protected people from infection with the new coronavirus. There is some limited evidence that regularly rinsing the nose with saline can help people recover more quickly from the common cold, which is another virus. And however, regularly rinsing the nose has not been shown to prevent the respiratory infection so far. Okay. Today is the 30th of July. Maybe on the 1st of August, next day, we will have some other data. So be critical always to the information that you receive and be updated. Follow those sites that I recommend to you, and you can receive more and more professional information. Drinking alcohol. Some people, for example, in Russia, even medical professionals, I've heard from them that if you drink especially hard or concentrated drinks, then it will protect because it will kill the virus. No, unfortunately, it will not protect and even be harmful for the immune system. Definitely now, after the vaccination, the people should abstain from alcohol drinking because this may interfere with their response to the vaccine. Clearly, this is clearly stated in all official documents. Now, some people believe that the virus can be killed by heat, and they expose themselves to the strong sun, temperatures higher than 25 centigrade. Unfortunately, it will not also prevent or cure the COVID-19. Countries with hot weather, as you know, are reporting large outbreaks, although they have above 40 degrees Celsius. So to protect yourself, make sure that you clean your hands frequently and thoroughly, and avoid touching your eyes, mouth, and nose. This is the WHO advice. The opposite belief is that the COVID-19 can be transmitted in areas with hot and humid climates, but it will be not transmitted in the cold climates because the cold temperature will kill the virus. No, this is also disbelief. And we have also in cold climates, the virus, the viral disease. And again, they are saying what is the best way to protect yourself. I will not repeat this information. And this is about the cold. So any extreme of temperature is not helpful, unfortunately. Another belief that taking a hot bath, this is another TCAM approach. So this may be helpful to prevent the new coronavirus disease. Unfortunately, this is not shown in the evidence, and your normal body temperature remains around 36.5 to 37 Celsius, regardless of the temperature of your bath or shower. Actually, taking a hot bath with extremely hot weather can be harmful, as it can burn you, and also this is a burden for the cardiovascular system. As you know, it may cause extreme vasodilation and reduce your blood pressure and may cause reflex tachycardia. For the people with cardiovascular disease, the heart may not withstand that, as you know. So the best way to protect, we already know what is the best way. And the general recommendations that you can recommend to other people, also according to the WHO, is to give a good nutrition advice. Eat a well-balanced diet every day to get the vitamins, minerals, dietary fibers, proteins, and antioxidants from the fresh vegetables and fruits. By the way, many people, including maybe your families, they believe that when we are aging, it is necessary to take the multivitamins or different supplements. Many studies show that the synthetic vitamins are not helpful, neither against COVID-19, nor against aging or cancer or cardiovascular diseases, in comparison with the healthy vitamins which come from the fresh food. As I said, fresh food is the best source of the vitamins, not the synthetic vitamins. I don't know, because of some stereo structure in natural products, we have some additives, first of all, that help absorbing these vitamins and nutrients. Second, as I told you, stereoisomery is different between the synthetic product and the natural product. So always favor the intake of the natural products. And generally, you should advise to take 2 cups of fruits, which is 4 servings, or 2.5 cups of vegetables, which is equivalent to 5 servings, 180 grams of grains, which is in Russian, it is kasha. Maybe you are familiar with these Russians, many of them, they start with kasha, as well as many European people, grains, and 160 grams of meat and beans. For example, red meat should be consumed only once or twice per week, and poultry 2 to 3 times per week. And the rest of the time, there should be other sources of protein, such as fish and also plants. Especially in the Eastern countries, plants such as, beans and cereals are a rich source of protein. Drinking 8 to 10 cups of water per day. Water is the best source itself, and adding the lemon juice diluted in water and unsweetened tea and coffee, and avoiding too much caffeine, because caffeine is diuretic, as you know. Caffeine present in coffee and tea is diuretic. It enhances what? The excretion of water, and the body loses water and may result in dehydration if you drink tea and coffee. And by the way, cola drinks also, they contain caffeine. Also, you should avoid sweetened fruit juices because they contain preservatives, which may be not safe, and also they contain too much sugar. Fruit juice concentrates, fizzy and still drinks, as they all contain sugar. Limit your salt intake to less than 5 grams, which is equivalent to 1 teaspoon full per day, and use iodized salt, because adding the iodine will protect our thyroid gland, which is also very essential in immunity. And limit your intake of soft drinks, as we said already, to avoid excessive sugar. We will stop here for a break. We have 5 minutes of break, and please, we will resume at 11:50. Go now, because you will have only 10 minutes. Okay. We continue our talk, and we saw the WHO recommendations regarding the main beliefs. Sorry, I need to keep the watch. And what are the other official bodies' recommendations regarding these popular treatments? Many people are asking about currently. As I mentioned, one of the mostly referred international recommendations regarding the COVID-19 treatment is the NIC. NIC stands for the National Institute of Health from the United States of America. And currently, they are saying that regarding vitamin C, there are insufficient data for the COVID-19 treatment guidelines panel to recommend either for or against, which means that they are not certain whether we should recommend vitamin C or not. No sufficient data. As I told you, stay updated. Regarding the vitamin D, what are they saying? There are insufficient data for the panel to recommend either for or against the vitamin D treatment. Same thing. We cannot say anything, neither yes or no currently. Zinc. There are insufficient data for the panel to recommend either for or against the use of zinc for the treatment of COVID-19. Same thing. And they recommend against using zinc supplementation above the recommended dietary allowance for the prevention of COVID-19, except in a clinical trial, which means many people, for example, in Jordan, when I come from, they go to the pharmacies, they purchase a large number of zinc tablets, and they start consuming huge doses to protect themselves. You as a medical professional should know that large consumption of zinc will cause the deficiency of copper in the body. So you enrich yourself with zinc, but you cause a lack of copper. And this will interfere with your immunity, and this will interfere with the other body functions, as I'm going to say further. So only as a clinical trial, the zinc supplementation should be used above the recommended dietary allowance. What is the recommended dietary allowance of zinc? I will mention further in my slides. Now, these recommendations, we have seen what did they say regarding the three treatments, regarding the vitamin C, regarding the vitamin D, and regarding the zinc supplementation. Now, I would like to show you where this recommendation comes from, how these official recommendations are created. So first of all, a little background about the vitamin C or ascorbic acid. As we know, it is a water-soluble vitamin thought to be beneficial in patients with severe and critical illness. And that's why several trials were conducted even with intravenous vitamin C in those people on mechanical ventilation with COVID-19. So it is an antioxidant, which means that it inhibits the toxic oxygen radicals, those radicals that are released during inflammation and that cause damage of our bodies. So antioxidant, free radical scavenger, capturing these toxic molecules. And this results in anti-inflammatory properties. We suppress inflammation. We influence cellular immunity and vascular integrity. So we improve the immune response. We keep the vessels strong and tight. As we said, when the vessels are not tight, there is shift of fluid into the tissues and there is edema or swelling of the tissues, and serves as a cofactor in the generation of endogenous catecholamines, or all are very useful properties. And during the oxidative stress, such as infection, in infection, we have oxidative stress and we have release of these toxic molecules. It is believed that the body requires more vitamin C, and the vitamin C supplementation has been evaluated in a number of diseases, including serious infections and sepsis. And because the SARS-CoV-2 infection may cause sepsis, and acute respiratory distress syndrome that we discussed already many times, or ARDS, the potential role of high doses of vitamin C in ameliorating inflammation and vascular injury in patients is being studied. So we are in clinical trials. But some of these trials have been conducted, and we already know what is the recommendation of NIH, neither pro nor against using the vitamin C. Let us look at the results of this clinical trials. One clinical trial was investigating the oral ascorbic acid versus zinc gluconate versus both agents versus standard of care. This means that in this clinical study, there were 4 groups of patients. One group was receiving vitamin C ascorbic acid. The other one was given zinc. The third group was receiving their combination. And the fourth one was receiving the standard of care, which means none of these supplements. So this is an open label clinical trial. Open label is not the optimal design. As I told you in my previous lectures, the best design of the trial is randomized, blind, placebo-controlled trial. Open label means that the patients knew what is this treatment. The doctors knew what is this treatment, and this could create a bias. Maybe it's too much to discuss the designs of the clinical trials here, but it is not good when the patients and the doctors know in which particular groups they are. Particularly if they know that they are in the standard of care group, they do not receive additional treatment. They will not believe much in this new treatment because they know that I received just the placebo. Placebo is dummy, is nothing. So this is the disadvantage of this trial. And the patients that were enrolled in this trial were outpatients, which means non-hospitalized patients, but they had a laboratory confirmed infection with SARS-CoV-2. They were randomly distributed among the 4 groups, and they received what? 10 days of oral ascorbic acid. I would say that this is quite huge dose, 8,000 milligram or 8 grams. This is quite a huge dose of ascorbic acid. Zinc gluconate was at the dose of 50 milligram. And as I said, the third group, both agents and the 4th standards of care. The primary endpoint, what did they look at this trial? The number of days required to reach a 50% reduction in the patient's symptom severity score, which means that in the beginning, they assessed how severe are symptoms. For example, the score out of 25, score out of 100, I don't know. And the patient should reach decrease by half of this severity score. So when did he reach this? After what number of days they looked at? The study was stopped early. Why? Because after 40% of the planned 520 participants, there was futility, which means no point to continue this study. Patients who received standard of care achieved 50% reduction in symptoms at mean 6.7 days. Ascorbic acid group achieved this after 5.5 days. Zinc group 5.9 days, and combination group 5.5 days. Do we see the difference? Not much difference. Yani administration and comparison to the standard of care was the same, and it did not reach the significance when we statistically conduct analysis, statistical analysis. The p-value should become less than 0.05. Now the p-value is not statistically significant. That's why the trial was stopped, even without being finished. Moreover, non-serious adverse effects occurred more frequently in patients who received supplement. For example, in ascorbic acid, almost 40% experienced adverse effects, in the zinc, almost 20%, and in the combined group, 32% of adverse effects, and 0% of patients on the standard care. So basically, the patients suffered from the adverse effects, and they did not get any benefit in this trial. See, how do we make the conclusions? From where come the recommendations? Tamam? What was the, okay, we said the adverse effects were non-serious. What were these non-serious adverse effects? Mostly gastrointestinal upsets, such as heartburn, cramps in the abdomen, nausea. And the limitation of this study include a small sample size, the lack of a placebo control. Placebo, you should give similar, something looks like a tablet, as I explained earlier. And so this is the conclusion that I have already pronounced. The other trial was conducted in China, and it was on intravenous vitamin C alone in patients with COVID-19. This was a pilot, which means a small clinical trial, only 56 adults with COVID-19. But as you can see, these patients were critically ill. In the previous study, we were talking about the outpatients who received the oral medication. Here we are talking about severely ill who are on the mechanical ventilation. They stay in the ICU, and they received huge dose of intravenous vitamin C, 24 grams, compared to 8 grams orally in the previous study per day. Or the other group received the placebo. Placebo means something similar. Maybe a normal saline was injected so that the patient thinks that this is treatment as well for the psychological reasons. So duration was 7 days. Again, this study was terminated early due to a reduction in the number of cases of COVID-19 in China. You remember that in China, they quickly controlled the situation. So there was no more ICU patients at that time. It was not possible to conduct the trial. Overall, the study found no differences between the arms in mortality. What is mortality? Number of deaths did not differ between the placebo and the vitamin C. The duration of mechanical ventilation, also no difference, or the change in the median sequential organ failure assessment score, SOFA score. SOFA score is the score that we use in the assessment of the sepsis patients, critically ill patients, regardless of COVID-19 or not. So, major parameters did not differ between the vitamin C and the placebo. So what is the point to recommend the vitamin C intravenously in the critically ill patient? Some other outcomes were also assessed. I will not go into details. Now, regarding the vitamin D, I will show you some clinical studies. As you know, the recommendation is also not definite whether to recommend or not to recommend this supplement. But the rationale, we know from where the rationale comes from. The vitamin D is essential not only for the bone and mineral metabolism, but also vitamin D is present on the immune cells, which are essential for us to battle the virus. It is present on the B cells, T cells, antigen-presenting cells, and because these cells can synthesize the active vitamin D metabolite, vitamin D may be potentially modulating the immunity. But one thing that we know for sure, I believe that was a British study that has shown people who have deficiency of vitamin D, they have low level of vitamin D in their body, they are predisposed to more severe disease, COVID-19. But this is the observational study, which means, okay, this is the observation. Doesn't mean that we have to use the vitamin D in these people. We have to show that in clinical trial. Starting using vitamin D, showing that it will produce data. Just observation is not enough. I hope that you get my point, what I mean. Just observational study is not enough. Okay, this is useful. Based on this study, we have to conduct the randomized controlled clinical trial. And what is vitamin D deficiency? Probably you know that when we measure the serum concentration of 25 hydroxy vitamin D, and it is 20 nanogram per milliliter or below, this is deficiency. So particularly in the older patients and patients with obesity who had this deficiency, and also those who are hypertensive, they were associated, I repeat, with worse outcomes. They had more severe COVID-19. Okay, I may skip some further information, but before COVID-19, vitamin D, because of its effect on the immunity, positive effect on the immunity, it was tried in other respiratory tract infections. For example, in influenza, other respiratory tract infection, and there was a meta-analysis. I've explained in my previous lecture what is meta-analysis, when we have a number of different clinical trials, but a group of scientists come and combine the results from all these clinical trials conducted in different countries, at different patients, at different centers, and they do statistical analysis for this pooled number of patients. So this is the best design actually of the study. It is the strongest evidence, and the meta-analysis of randomized clinical trials with vitamin D supplementation was shown to protect against the acute respiratory tract infections. However, there were 2 double-blind, placebo-controlled randomized clinical trials where administering high doses of vitamin D to critically ill patients with vitamin D deficiency, but they were not COVID-19 patients, other respiratory tract infections, but they were critically ill. This did not improve their outcome, did not. Neither the length of hospital stay was improved or the mortality rate, which is the death rate, was improved. So we are uncertain, even before the COVID-19, we are uncertain the vitamin D. And high levels of vitamin D, why should they be avoided? You have to tell your families who believe in vitamin D, then they might consume the huge doses of vitamin D, 5,000 units per month. They take a single tablet because they believe that it will protect their cardiovascular system as well, and so on. Anti-aging effect. No, you have to tell them that administration of such huge doses causes hypercalcemia, which means the calcium level in the blood will be elevated, and nephrocalcinosis, which means the formation of the calcium-containing renal stones. They will develop stones in their urinary tract containing what? Calcium. Because the calcium is elevated in the blood, then it goes to the urine, and in the urine it will form the renal stones. Besides that, there will be calcium deposition in the soft tissues. This is not good. In the coronary vessels, in the heart muscle, etc., etc., etc. So it is not safe. You might believe that vitamin, oh, this is vitamin, I can consume whatever doses. No, it is not safe, as we could see for the vitamin D and zinc. I've already mentioned the zinc. So the rationale why the studies are conducted until now on COVID-19 and vitamin D, because we have the data about the immunomodulation that potentially protects against COVID-19. And we have ongoing observational studies evaluating the role of vitamin D in preventing and treatment of COVID-19. And some trials are being planned or already recruiting. And let us see what clinical data do we have so far. There was a randomized clinical trial on vitamin D versus placebo. Placebo is dummy or empty tablet or empty injection in patients with moderate to severe COVID-19. Double blind, this is good. Nobody knows what is the treatment. Placebo controlled, this is good. We compare with placebo, this is optimal. Randomized, this is good because the drugs or the patients were, randomly distributed among the groups. So the optimal design, that study was conducted in Brazil. 240 hospitalized patients with moderate to severe disease, as I said, received either a single dose of 200,000 international units of vitamin D3, or the other group received placebo. They gave the definition, what is moderate to severe. I will not go into the details because you are not clinicians yet. The most important, that they looked at the length of hospital stay. The good thing if the patient stays in the hospital for less period of time, right? So what did they show? The length of stay was not significantly different between the vitamin D group and the placebo group. For vitamin D, 7 days, placebo group, 7 days. No significant differences were observed between the arms in the other parameters, such as percentage of patients who required admission to the intensive care unit, who required mechanical ventilation or who died. But to be fair, we should state that the number of patients was small, and maybe we need further clinical studies on a bigger number of patients. And also the enrolled participants in these studies, in this study in Brazil, had variety of comorbidities and concomitant medications. And this means that other factors could interfere with the results of this study. We need to look at that always. Okay, I think regarding this study is sufficiently clear. And now regarding the zinc, why regarding the zinc, we have the same recommendation. Why they do not recommend neither for nor against the zinc administration, I mean the National Institute of Health. And why do they recommend against zinc supplementation above the recommended dietary allowance for the prevention, as I said? So what is the rationale actually behind the use of zinc? Increased intracellular zinc concentration efficiently impairs a replication of the virus. Zinc suppresses the viral replication inside the host cell against many viruses, not only the coronavirus, but also in general RNA viruses. How? Zinc is cytotoxic and induces apoptosis, which is a programmed cell death, when used in vitro with a zinc ionophore. And here the interesting thing comes. You remember in my previous lectures, I was talking about chloroquine and hydroxychloroquine, two anti-malarial drugs that were so giving us so much hope in the beginning, but later they did not show effectiveness in the treatment of COVID-19. You remember I was talking about that. Now, the conclusion and the recommendation is not to use chloroquine or hydroxychloroquine alone, but there is still one data that is saying that when you combine the zinc with zinc ionophore, which means that it increases the action of zinc, which is chloroquine, then there is enhancement of cytotoxicity of the immune system against the virus and induction of apoptosis, which means that facilitation of the programmed cell death, as I said, for the damaged cells occurs. So currently we are investigating what is the particular relationship between the zinc and COVID-19, including how zinc deficiency affects the severity of COVID-19. So all this is going to be clear later on. The problem is that unlike the vitamin D that we can measure in the patient's blood, the zinc measurement is difficult because the zinc is distributed as a component of various proteins and nucleic acids. You cannot enter with the analytic device inside these proteins or nucleic acids. And several clinical trials are currently investigating the use of zinc supplementation either alone or, as I said, in combination with the hydroxychloroquine in the prevention and treatment of COVID-19. And I mentioned that the recommended daily allowance of zinc should not be exceeded because it may be toxic. What is the recommended daily allowance of zinc? 11 milligram daily for men and 8 milligram for non-pregnant women. And unfortunately, the clinical trials that were using the zinc, they were giving the patient up to 220 milligram, which is equivalent to 50 milligram of elemental zinc twice daily. So this is quite an excessive dose. However, there are currently sufficient data to recommend either for or against the use of zinc for the treatment of COVID-19, as I explained. This thing I would like to repeat again, that long-term zinc supplementation causes copper deficiency. So what? Copper deficiency. What is the result? Hematological defects, which means the blood disease, like anemia, leukopenia, decreased RBC count or decreased the WBC count, potentially irreversible neurological damage, myelopathy, which means damage to the skeletal muscles, paresthesia, which means numbness you feel numbness in the extremities, ataxia, which means unstable gait, spasticity, spastic contractions of the muscles. And the use of zinc supplementation for duration as short as 10 months has been associated with this copper deficiency. In addition, oral zinc can decrease the absorption of medications that bind with polyvalent cations. That's why I repeat, the panel currently recommends against using zinc supplementation above the recommended dietary allowance for the prevention of COVID-19. I'm talking about the prevention, not about the treatment, because the treatment is short-term. It might be justified in treatment to exceed daily allowance, but for the prevention, no. Just a couple of data about the clinical trials. There was a randomized clinical trial of zinc plus hydroxychloroquine versus hydroxychloroquine alone in hospitalized patients. It was conducted in Egypt, and it included 191 patients with laboratory confirmed SARS-CoV-2 infection. They were randomized either for a zinc 220 milligram twice daily, plus hydroxychloroquine or hydroxychloroquine alone for 5 days. And they looked at the recovery within 28 days, and the need for mechanical ventilation and death. And the two arms were matched for age and gender, which is good. Sometimes when the design is not good, we have only females in one group and only males in other group. And the gender may be a factor that affects the clinical outcome. Or in one group, we have collection of elderly people. In the other group, we collect collection of young people. This is not good as well. So they randomized them very well between the two groups, genders and the age. And the results, no significant differences between the two study arms. Regarding the recovery within 28 days, 79 versus 78 almost % in both groups, in the need of mechanical ventilation or overall mortality. But the limitation of that study was a small sample size. So when we have some defect in the study, this means that we have to continue studies with better design, Or another study that I have already mentioned in the beginning when I was talking about the ascorbic acid. One of the limbs of that study was zinc, and there was no difference between ascorbic acid, zinc, or their combination and the placebo, as I already discussed with you. And the third study was observational study. Observational is not strong design. The strongest design is the prospective. When you decide what to do at the baseline, and then you go in the future and see how the patients are doing. This is prospective. You go into the future. After 28 days, you look at the outcome, as I told you, after 1 week or so. But observational, this was a retrospective. They just looked into the past. They looked into the past, how the 242 patients were doing with a confirmed infection. They were administered in a certain Hoboken University Medical Center. I don't know where is this to be honest with you. And they were distributed among the zinc sulfate or hydroxychloroquine. And they looked at the hospital admission to it, hospital mortality. And anyway, the most important thing is that in the zinc arm, 37% of patients died. In the control arm, 45% of the patients died. Which means, okay, maybe if you look at the p-value, it is statistically significant. No, it was not statistically significant. I told you the p-value should be less than 0.05, but it is 0.09, which is bigger than this number. It is not statistically significant. And even the p-value, when you look at the data, is not that important. You look clinically. You just look using your general sense. Is mortality of 37 far away from mortality of 46? Just several percentage difference. Is this clinically important? For me, it will be more impressive that if I say we twice reduce the mortality, or at least by 50% we reduce the mortality, but not by 7% as here. 7% reduction in mortality with p-value more than 0.05 is not an impressive result. So, however, we need to keep in mind that limitation that it is retrospective, as I said, and the patients were not randomized to receive zinc supplementation or not to receive the zinc. So the bottom line that at current stage, as we could see from the examples that I provided, there is no clinical evidence of TCAM to treat COVID-19. We have lack of high quality data. The data come from poorly designed or underpowered clinical trials, little or no data to support their claims, lack of statistically significant number of participants, as I have demonstrated, lack of long-term efficacy. Okay, maybe we can see short-term improvement, but what is the overall improvement on the long run? You know that now many COVID-19 patients, they experience what do you call it, long haul COVID-19. After several months, they are still complaining of fatigue, of shortness of breath, neurological complaints. Many of them have cardiomyopathy and so on. We don't know the data about the effect on these long-term outcomes. Proper follow-up was not conducted, how the patients were doing after the discharge, for example, from the hospital. No comparative control groups, as we could see in many trials, no adherence to strict quality norms while conducting these clinical trials, because we are in a hurry. We are in a hurry conducting these clinical trials to have some data, something to give us hope. We are in an emergency situation. So ideally designed clinical trials do not exist at the current stage. That's why we need to continue these observations, and we need further research as per standard protocols. And currently, until this will be performed, the complementary and alternative medicine will be seen with a lot of skepticism in medical sciences. A lot of skepticism, we mean that many people do not believe it very much. Okay, maybe some people believe, but many people, they do not believe. We need to go and perform more and more clinical data. I have used so many references, including the articles, including the WHO and other recommendations in preparing this lecture as usually. Thank you very much for your listening. And I'm so glad that a big audience was listening to me today. We have quite time, maybe about 10 minutes to handle your questions. If you have any questions regarding today's lecture or regarding the previous lectures, I was talking about the vaccines. I was talking about the standard protocols for the treatment of COVID-19, and I was talking about the investigational treatments. Any question, you're welcome. Thank you very much. Very excellent, very interesting question. I wish we could genotype all populations and conduct the trials based on these differences in genotype. I wish. However, this is too expensive, and maybe few countries, very advanced countries in research, can conduct these trials. Yes, so we know that certain genetic differences, like those that I mentioned in my previous lectures, for example, difference in the gene encoding for the interferons. Some people who have this genetic defect, they do not have sufficient level of interferon in their body, and interferon is a very well-known protective endogenous substance against the virus. So if there is lack of interferon, probably this predisposes to more severe infection. But unfortunately, the differences between countries that you mean in the treatment protocols is based not on the differences in genotype. No, it is based on the opinions of the experts in each country that designs these guidelines. In the United States, they have their own panel of experts based mainly on the clinical trials conducted in the United States. In Russia, the panel of experts, they base their recommendations on the clinical trials conducted in Russia and maybe some other countries. Sometimes the multinational, multi-center trials are performed involving many countries. So whatever experts decide in each country, this is translated into the recommendation, into the guidelines in the country. I hope that I answered this question. Thank you. Other questions? Yes. Okay, concerning the first part of your question, definitely I encourage any person to obtain the vaccination. Definitely. Why? I will explain why. Concerning myself, I was among first people in Jordan. I was in Jordan at that time. In January 2021, I received the Sinovac, which is Chinese vaccine, because in Jordan we have multiple types of vaccines, whatever we receive, and it is like lottery. We register on the platform, and on a specific day they call you, come and receive the vaccine, and we don't know what particular vaccine will be on that day. The other family members, some of them received Pfizer, I received the Sinovac, and so on. But still, I believe that any vaccine, so if you are in Russia, you have 4 types of vaccines, but mainly predominant type is the Sputnik V, available currently in Bashkortostan region, mainly Sputnik V. So whatever vaccine is, it will protect you against the disease. It is much better to experience, if any adverse effect of the vaccine occurs, it will be mild. It is much better to experience these adverse effects that will be mild than to experience the disease, because the complications of the disease are severe. They are much more common, much more, thousands times, much more common. Deaths are common from the disease, reaching 2% on average, if we are talking about the world, but in many countries it is exceeding 2%, which is 10 times higher than the deaths from influenza. Definitely you have to go for the vaccine. Maybe there is no 100% of protection, as I told earlier, and maybe some vaccines, they protect. Even Sinovac that I received, okay, there was a Brazil study that was showing that there is only 60-something% protection of Sinovac against the Brazilian type. Still, it is better. It is better than to have the COVID-19. So what? 68%, this is a good protection. Influenza vaccine, by the way, influenza vaccine, which I receive every year, also offers only 60-something protection, 68 maybe % protection. This is a good percent. But if you are talking about the Sputnik V, it offers 97.5, I think, % of protection, which is almost absolute, which means that only 2.5% of people after vaccination, they have a chance to get COVID-19. But what will be this COVID-19 after the vaccination? It will be just mild to moderate. Do you see the difference? If you get the disease after vaccination, it will be much milder. You are protected against hospitalization and you are protected against death, which is the most important for you, right? Do you care that you have the mild, common cold-like disease, or you care about the severe disease, which results in hospitalization, mechanical ventilation, and death? Definitely, you need to protect from the other type of the disease, most severe. Also, being conscious for the society is important. When you protect yourself with the vaccine, doesn't mean that you stop being infectious to the others. Still, you are infectious to the others. You are a carrier, yes. Unfortunately, the current type of the vaccine, because it is given into the systemic circulation, it interferes with the virus which is within your body, but it does not interfere with the virus that enters the nasopharyngeal mucosa, because the on the mucosal lining of your nose and throat, where the virus starts its entry, we have another defensive mechanisms. We have other types of immunoglobulins. The vaccine offers you immunoglobulin type G, IgG, right, in the systemic circulation. But on the mucosa, important type of the immunoglobulin is the IgA. And you do not offer the protection with the vaccine, which means that you may harbor, after you are vaccinated, you may harbor the virus in your nasopharynx, and you do not suffer from the disease, but you are spreading the disease to the others. And here there is the importance of massive vaccination. Why they are talking about the herd immunity, that previously it was believed that 60% of population should be either antibody positive of the disease, or they should be antibody positive after the vaccination. They were saying about the 60%. And if we reach this 60% of herd immunity, then the population is protected. Now, because of the new mutants like Delta mutant, from the example of Israel, what do we see in the Israel now? 60% or more of population is vaccinated, but now they are experiencing the outbreak despite of being vaccinated. Now it is clear because of the new Delta variant of the virus, we need not 60%, we need 80% of population of being protected by the antibodies, by the vaccine mostly. So here your dual role, you protect yourselves, and also if most of the population is vaccinated, of course, we have people with contraindications. Yani we will not vaccinate the person who has severe history of anaphylactic shock, right? The severe allergy will not. But if majority of population is vaccinated, then we stop the spread of the virus. This is the only solution. So you have to be conscious about yourself. You have to be conscious about the society to be the part of this herd immunity, to protect the others. Maybe you will have the mild disease, but your grandmother or your father, la samahallah, God forbids, may be infected by you. So this is your role for the society as well. All right. Other questions? Yes. The vaccine is? There are side effects, but as I described, they are mild to most, they are mild, consisting, of little pain and swelling and redness at the site of injection. Some people experience moderate adverse effects such as fever, but this is good. Starting from your childhood, you had many vaccines and they produce the same side effect. Nothing extraordinary about the COVID-19 vaccine. And even thrombosis that we hear about from the AstraZeneca or Johnson & Johnson vaccine, 4 per million people. 4 per million people. And most of them survived after thrombosis. If we are talking about the myocardial damage after Pfizer vaccine, also several in hundreds, this is negligible amount of side effects if we are talking about serious adverse effects. And by the way, we don't know, maybe these serious adverse effects are not due to the vaccine, but because we pay attention at these adverse effects after the vaccination. Maybe this is the same prevalence as without vaccine in the general population of myocarditis or thrombotic complications, such as cerebral sinus venous thrombosis that was described mostly after AstraZeneca. So with the Sputnik vaccine, there is no reports of deaths or serious adverse effects. There are only mild to moderate adverse effects. So it is considered to be very safe. And hopefully this vaccine will receive the authorization by the WHO very soon, hopefully. Okay. Other questions? Do we have time? No, we don't have time. We have barely 1 minute. And I would like to thank you once again for your participation and for your kind attention. And I wish you to stay safe and all the best in your studies and the future. You're welcome.
Thank you so much.
You're welcome.
The Sudania.
Good.
Now there is a second part, I believe, for the students from Arabic countries. Rasul Saleh asked me to have a meeting with you. Let me call him and see if I need to stay with students from Arabic countries. Расул Сафирович, добрый день еще раз. Вы хотите, чтобы я осталась с арабскими студентами, или вы отменили?